News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. There's a chance as you're watching this show that you know someone who's depressed, and you know the effect that depression is having in their lives. Physically, mentally, emotionally, spiritually, their relationships, school, career. Depression can really affect one's whole life. And people who are depressed will say that they feel that their depression is taking their life away from them. Many people who are depressed suffer in silence, but in today's show we want to share with you that you don't need to suffer in silence. There is help and there is hope. We have an excellent expert guest today, Dr. Sibel Yashar. Dr. Yashar treats children, adolescents, and adults for a variety of problems and difficulties in their life. Depression, anxiety, bipolar disorder, substance abuse, chronic mental illness, people who have brain injury, a whole realm of people that are having difficulties in their life. Dr. Yashar is really helpful to them. And Dr. Yashar, we are so grateful to have you here for the show. Thank you for coming in.
Thank you for having me. Thank you.
So the first thing that I would like to ask you as we're talking about the depressed patient is, when someone comes in to see you at your office and they share with you that they're not feeling well, that they're feeling depressed, how do you go ahead and talk with them about their life and about their depression?
It is really important to listen to the person and having a Therapeutic Alliance from the start. It's really important to understand what depression did to them and how it changed their lives.
Yes.
It is also important to have a thorough assessment to understand what the symptoms are that they have been experiencing. Excuse me, there are different kinds of depression, and it's important to understand what kind of depression they are going through, and of course the symptoms that impair their daily functioning on a day-to-day basis. Depression may affect one person's overall functioning within the family, social functioning, as well as work. It is important to understand the person as a whole. And also discuss in details how the neurovegetative symptoms of depression are presenting. That includes their sleep, if there has been any disturbance in their sleep, their interest, if there has been any loss of interest, if they have problems with self-worth and self-esteem. It is also important to understand how the depression affected their concentration level, energy level, if it affected their interest in life, and also if it's causing suicidal thoughts.
Yes.
It is really important to assess the safety of the patient, especially if there is suicidal thoughts involved.
Yes.
That leads me to understand better whether the depression is quite severe and requires immediate and acute treatment, maybe in a hospital setting, if there are safety concerns, or if the depression is manageable with outpatient treatment, with office visits, and also with therapy.
Yes.
So this is, in a nutshell, the first assessment with the patient to understand the nature of the depression.
So at the beginning, Dr. Yashar, you were talking about establishing rapport. So I guess one of the things that you want to communicate, whether it's a child or a teenager or an adult, is that you're a healthcare professional who cares about them, and you want to help them.
Absolutely.
And for them to, and I know that about you already, but for them to understand that that's who you are, huh?
Absolutely. And also it's really important to have that Therapeutic Alliance and also give them hope.
Yes.
That there is treatment for it, and there's different variety of treatments depending on their needs.
Yeah. So you kind of let them know that you realize how much they've suffered, but then you also communicate with them, I can help you find a way out of this. You can have a life free of depression.
Absolutely.
Yes.
We have great tools to treat depression nowadays.
Yes. And then very quickly, could you go through some of the vegetative symptoms again maybe for the layperson,
Absolutely.
in about a minute.
Of course.
Okay.
And the first symptom of depression is that the depressed mood, sad mood that is persistent, that persists for 2 weeks or more.
Yeah.
And with that, people may have may experience change in their sleep pattern. They may start sleeping more or less.
Yeah.
They may have problems with waking up at night quite often, or waking up early in the morning. There may be different types of changes in their sleep, decreased interest, decreased energy. People may have decreased concentration. They may also have changes in their appetite. Some people tend to eat more
Yes.
or less
Yes.
with their depression. And also they may feel slowing down.
Yes. Great. This is great, Dr. Yashar. It really gives us an idea of how you greet your patients and how you help them understand their depression. And then next now, we're going to talk about how Dr. Yashar talks with her patients about various types of treatment, and she offers them help and hope. We'll see you in a minute. Hello, and welcome back to New Skills for Living. You'll see up on your screen the website, easeap.com. At that website, you'll be able to see this interview with Dr. Yashar, as well as many other interviews. And so please go to the website to see Dr. Yashar's interview and let other people know about this excellent interview. Also, I want to show you now, there are over 80 newsletters on the website on anxiety, depression, substance abuse, self-esteem, relationships, healthy workplaces. If you go to the easeap.com website, you can access these newsletters and download them and share them with others. So in this next segment now, Dr. Yashar in the first segment was talking about there is help and there is hope for depression. And now we want to ask you, Dr. Yashar, can you talk with us about the therapies for depression?
Sure. There's different kinds of treatments available for depression. When there's mild or moderate depression, patients, people can choose medication treatment or individual therapy. Either one works great. However, with moderate to severe depression, I would like the patients to have both medication treatment and individual therapy. It's really important to emphasize that medications are a great help to treat depression, but when it's combined with therapy, they work better, and people are more able to change their distortions or disturbances in thinking, negative preoccupations, things like that that leads
Yes.
to depressive thoughts.
Yes.
So it's really important to combine those two together. It is also important for all of us to emphasize on healthy diet and exercise, a healthy way of life. When combined all these together, it's really, we see great results. People who are able to take charge of their lives and change things in their lives have great benefits from all the treatments. It's really important to combine all of them. And I would like to talk a little bit about medication treatment. There are really great tools and medications available for treatment of depression with very tolerable side effects profile compared to older treatments in the past. Some of the older medications are still available and they're still widely used, but newer medications are very, they have very good efficiency and as well as a tolerable side effect profile. So it's really important to talk to a professional and get professional help for medication. When I start my patients on medication, I always ask about individual therapy as well. And I try to motivate them to combine both treatments. I'm a great believer of therapy. There are different kinds of therapies available for treatment of depression. Cognitive behavioral therapy is one of them, as well as interpersonal therapy, psychodynamic therapy. If there is need for improvement of primary support, I like to include families, primary support group, and that really helps people to lift themselves from depression with the help of their relatives
Yes.
and loved ones.
Yes.
So it's really important to combine these together. Sometimes group therapies are also recommended, and they do a great service to people. Group therapies are very helpful to sit together with other people who are suffering from similar problems, and to connect with them and to talk about their depression, learn about their depression. So all of these therapies are quite helpful.
Yes. And so, Dr. Yashar, we're going to end this segment right now, but it's so great to hear you talk about how, as a physician, you really want to treat the whole person.
Absolutely.
And when we come back after this break, we're going to talk a little bit more about treating the whole person, but then especially we're going to concentrate on a new therapy for depression called TMS, and we want to talk with you about that. So we'll see you right after this brief break. Hello, and welcome back to New Skills for Living. What you're looking at now is part of the information that's available on a brand new therapy for treating depression. It's called TMS, and we're going to hear more about TMS therapy from Dr. Sibel Yashar. This is an emerging therapy, and, well, I'll let Dr. Yashar tell you about that. So would you please tell us about TMS, Dr. Yashar?
Sure. TMS is an FDA-approved non-invasive treatment for depression. Basically what it does is it's a magnetic, it creates magnetic stimulation, repetitive magnetic stimulation, and it stimulates a certain region of the brain that is thought to be responsible from depression. And that magnetic field that is created with the pulses activates the neurons, and it helps the neurons to be stimulated. So it's a very localized treatment for depression. And the advantage of the TMS is that it can be used for treatment-resistant depression when medications don't work.
Can I ask you real quick, what is treatment-resistant depression?
When a person tries 1 or 2 antidepressant medications and don't show response or remission with the medication treatment, we call that treatment-resistant depression. If a person didn't respond to treatment with medication for approximately 2 months or 3 months, then we would consider changing the medication, and then if the second medication is not helping, that is kind of a broad term, but it is considered treatment-resistant depression. And TMS can be offered at that point of time to patients who suffer from treatment-resistant depression. It has better results if it's applied in early phases of chronic depression rather than trying everything and leaving that as the last resort. The advantages of the TMS is that it helps to stimulate the brain locally, unlike the medications that do affect our whole body. They go to all of the organs and also the brain, and that's how they work. But TMS works in a localized manner, and regarding the side effect profile, it's very well tolerable, and it's a non-invasive procedure. It includes 37 minutes of sessions, 5 sessions per week, for 4 to 5 weeks total. And it's, as I said, it's not an invasive procedure, so patients are awake during the treatments. They're sitting in a chair that resembles a dental chair, a dentist chair, and sometimes patients fall asleep, sometimes they prefer to listen to some nice music or watch a TV, and these treatments are done in an outpatient basis. Patients don't need to be in a hospital, they don't need to take anesthesia or sedatives with that treatment.
And when they come in, Dr. Yashar, about how long is the session?
It's about 37 minutes, and what they hear is the magnetic pulse that sounds like a woodpecker. So the magnet sits on their scalp, and as I said, it's not invasive. It just sits on the scalp, and patients sit comfortably, and then they hear that sound of that resembles a woodpecker. And it's most people find it quite relaxing. The whole treatment. They may be disturbed by the sound, so they use earplugs. So it's well tolerable, a good treatment for treatment-resistant depression. Some people cannot tolerate the medication treatment from the beginning, or some people have excessive or intolerable side effects from medications. For those people, TMS is the ideal treatment. And in some studies, it's shown that in long term, treatment with TMS provides a good remission rate, and most people do not relapse and have recurrent depression after TMS treatments. There were studies that were done for 6 months, and at the end of the 6 months, people who used medications, 40% of them relapsed, had depression symptoms coming back. However, the patients who had TMS, only 10% of them had some depression symptoms coming back. So there are lots of advantages of TMS treatments.
Yes, there are. We have about a minute left, and I guess as our audience is hearing you talk about TMS, what is just one thing you'd like to share with them about this treatment? If they or a family member is on an antidepressant and they're unsatisfied with the side effects or the way it's affecting their depression. We have about a half a minute now.
Right. I would like them to talk to their psychiatrist about TMS and inquire about TMS. They may also go to YouTube and enter keywords Neurostar TMS. They can look for UCLA. There's a good little video from University of California, Los Angeles that talks about TMS. A patient actually is talking about TMS treatments from Emory University. For Neurostar, who's the company that has the TMS machine, they have a good website as well.
One real quick question. You mentioned people could talk to their psychiatrist. I guess if their primary care physician has been prescribing the antidepressant, they could talk with their primary care physician about TMS therapy as well, right?
They can. They can.
Okay. All right. That was some great information, and what a great new therapy that's available to us here in Northern Nevada now with Dr. Yashar. We'll see you right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Sibel Yashar about how there is help and there is hope for people suffering from depression. And we've been talking about adults who suffer with depression, but the sad thing is that adolescents and children also suffer from depression. But then the good news is that there is help and hope for children and adolescents. And so, Dr. Yashar, I would imagine you treat children and adolescents a little differently. Can you talk to us about the recovery process for children and adolescents, please?
Sure, absolutely. The first thing I would like to mention, though, was that depression presents differently in children and adolescents. When children and adolescents are depressed, they won't withdraw and stay in their room all day. There will be problems such as acting out behaviors, irritability, agitation, withdrawing from family, having relational problems with their friends. Those are warning signs. If the teachers are involved, they can also notice some of the problems that kids and adolescents experience in their change in their school life and in their social environment. So that's really important to recognize. It's really important when the children and adolescents are depressed. I really would like them to get involved with a professional, a psychiatrist, and get treatment, because it is treatable. Depression is treatable in all ages. When treatment is discussed with parents, often the concern is about safety of use of antidepressants. There's a lot of attention to medication use in kids and adolescents, but all in all, it is noted that when treated with medication treatment, the benefits of the medications really outweighs the risks of the medications or the side effects. Often the concern is increased suicidal thoughts with the new black box warnings for SSRIs, the antidepressant medications that we have been using in kids and adolescents. It's important to monitor safety during the initiation of therapy, for that matter. It is also worth noting that although there is warnings about increased suicidal thoughts, there's no evidence that medications increase the suicide attempts or suicidal gestures. So it's really important to treat the adolescents and kids in a fair way and provide them with treatment and monitor them closely during the initiation of therapy for safety matters. But I wouldn't withdraw the option of medication because of those black box warnings.
Yes.
It's just something that we have to deal with and we have to manage by close monitoring.
And that, of course, is why it's so important in your experience as a pediatric psychiatrist that you relate well with children and you understand them and they get that. And you watch them very closely. You care about children very much.
Absolutely. It's really important to have a Therapeutic Alliance with kids and adolescents as well. They often feel relieved that there is someone listening to them and understanding what they're going through. And they're often relieved that there is help available. It is also very important to refer them for therapy as well. It's really important to combine medication and therapy again, and also involve the families or the next of kin, the relatives, whoever their primary support is. It's really important to get help for them.
Well, Dr. Yashar, it's really great to hear you excuse me, talk about how, again, with children and adolescents, just like with adults, you treat the whole person. Physically, mentally, emotionally, you treat them as a member of a family. You help the parents. You work with the schools and the school counselors and teachers to help the child. So all of that, it's really great to hear how you do that. It's been great to have you here on New Skills for Living. The time has gone by so quickly. It's been great to have you here as our guest. I believe coming up on your screen is some information. Again, some of you will want to watch this interview with Dr. Yashar. And so that website up there, www.easeap.com, you can see Dr. Yashar's interview on that website. Thank you for joining us for New Skills for Living, and we'll see you next month as we continue to help our community with healing and wholeness. Thank you, Dr. Yashar.
You're welcome. Thank you for having me.